it's a very much like patient integrated process. It's not one-sided. And so, like I said before, like bring your questions. We'd love to answer them. And this is really a service that's kind of dedicated to empowering patients more so than anything else, and advocating for patients that might not be heard by other medical specialties, it's confusing. A lot of genetic syndromes are confusing. There are conditions where it's like, oh, you have a seizure, go see a neurologist. Oh, you have an eye problem, go see an ophthalmologist. Oh, you have a problem with your heart, go see a cardiologist. But no one puts all those things together as being cause of like the same underlying issue. So I think when someone has the opportunity to meet with a genetic specialist, really to understand that it's an integrative process. It's not something that you're here for us to tell you to do something. Like we're here for us to educate you and to empower you to do something for your own medical care or for your child's medical care. And I think that that's part of what we like to get across to people, but is not always understood as like, oh, you have to go see a genetic counselor. And then you Google it and it's like, well, I don't know what this is. And so I think there's just a lot of hesitation when it comes to that initial recommendation. And truthfully, no one wants to be told that their child has a condition or that they're at risk of a cancer or of developing an adult onset muscular disease. So they are very hard conversations to have, sometimes, but I think because there's that educational portion that's delivered with understanding and empathy and how can we help you to move forward, that overall it's a very grateful experience for both the providers and for patients.